Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi R. She is the past president of IMA Karavali, Udupi, and also the present president of Gynecology Society of Manipal. And apart from that, she's a very popular gynecologist, obstetricians. On top of that, she's a prolific writer and a columnist. And she has written Vatsalya the Osuge for the sake of people to understand their health in the womanhood. And today she is going to talk to us and tell us about how a woman has to take care after the delivery. We all have heard how many times they have to get their ultrasound, how many times they have to get the injection, what to take, what not to do during the pregnancy. But after the delivery, how long it takes for the woman to come back to normalcy, and what are the do's and the don'ts? Please tell us, Dr. Raj Lakshmi.
Yeah. Namaste. Thank you, ma'am. Certainly. Always we take care of pregnancy, because it is the care for two lives, mother and the baby. But once she delivers, that care shifts only towards the newborn baby most of the
Baby,
time.
and they forget the mother.
Mother, most of the
Okay.
time it happens. So, but we need to take care of that mother. The first 42 days or the 6 weeks, we call it as puparium. It is the time where her body gets back to her original shape and size, and she loses her weight. Her physiology also gets back to normal from the pregnancy level, where cardiac output had increased, the heartbeat had increased. She would have accumulated
And
some
the blood
water.
sugar, blood pressure,
Yeah,
all that will come back to normal.
water retention, all those things. Even some people get the pigmentation during pregnancy,
Yes,
and during
yes.
this week, this is all happens because of the hormonal changes in her. This all reverts back to the pre-pregnancy state in this 6 weeks. So we call it as postnatal care. So what do? We usually advise her on her diet, her exercise, her sleep, and her mental health. So
Correct.
food is a natural thing. Why should we advise? Because people have too many misbeliefs, misinformation.
And not to give, like, some people don't give water to drink, and
Yeah,
some people put them in the dark room, and
dark
so that
rooms.
nobody comes, and all those things are there. And I think
Yes.
the myth have to be removed from the
First,
minds.
why they
Yes.
used to keep her separate is because once she was bleeding, she will be bleeding most of the time. The first 10 days will be heavy bleed. After that, bleeding will go on decreasing, and then it will
Mm.
become lochia, some white discharge.
Mm.
So
Mm.
she needs to be protected against
From the
infection. So
infection. Yes,
yeah,
yes.
so because of that, they might have kept it separate, but it shouldn't be continued that she shouldn't come out of the room, she shouldn't speak to anyone, she should keep herself covered wherever she goes. There's some beliefs whenever they get, I have seen in the beginning days of my practice 20 years ago, whenever the first postnatal visit we call, they come with the key bunch. I
Mm.
don't know what is the connection between that key bunch, that is
No,
the
no.
metal, maybe
Sometimes,
iron
in the peripartum period, they used to get convulsions and fits and
convulsions,
hysteria, and hysterical bouts used to come.
bouts.
And
So
because
maybe
of that, they used to carry that. Yes.
yeah, some protection, or maybe the iron whatever is there in that used to give them that iron, I don't know, but that is what they used
Exactly.
to come like
Mm.
that. So all those beliefs should be not be followed now in the present era of antibiotics. We give them
Mm.
antibiotics so there won't be any infection, but they need to be care. They have to be given proper nutritious food with all
Yes.
carbohydrates, proteins,
Well
and
balanced food, because they
balanced.
are feeding the baby. The
Yes,
milk has to be produced and the quality of milk has to be good. For that,
good.
she has to eat the quality food. Yes.
Quality food, and that has to have all the nutrients. So because she
Yes.
has to transfer all the nutrients to the baby,
To the
baby is fully
baby.
dependent on. So you have to give a, as you said, well balanced diet. And we have some culture like they give some home remedies. The
Mm.
first 15 days they'll give be made up of ginger and our garlic and
Yeah.
menthe.
Menti
So that
yeah.
is to, yeah, that is to improve the breast milk secretion. That can be
Mm.
taken. And
Mm.
after some 15 days, they start giving laddu with all the dry fruits, which improves the
Dink laddu.
quality of,
Yeah.
yeah,
Mm.
quality of the milk. So that can be continued. But along with that, they have to give her proper nutritious diet. Not only tomatoes are for first 45 days. It won't
Okay.
help her in any way. The milk production will come down and she also will suffer. And next thing is about the water, as you said. They think that body has retained water and we have to uh, make her water deficient now, fluid deficient, so that she will come back to normalcy. No, if water is not given properly, she'll have constipation. So that can land up in bleeding during defecation. The milk secretion will be less and she can get repeated urinary infections. So fluid, water has to be given enough, 2 to 2.5
Adequately.
liters.
Yes.
Yes. And then she has to breastfeed. When breastfeeding has to be proper, she has to have a balanced diet which has iron and calcium. Iron to
And
supplement
all
her
the
blood loss.
micronutrients also. All the
Yes,
micronutrients also. Yes.
also. Iron to replenish her blood stores or hemoglobin which has been lost during delivery, and calcium for her and the baby both.
Baby
For
also.
her
Yes.
bones, which is getting transferred to the baby through the breast milk. So these things
Correct.
should be added in her diet.
Mm.
Next thing is exercise. Always people think that delivery means after
They
delivery
have
you
to
have to
sleep,
take
lie down,
rest.
keep lying down.
Yeah,
Yeah.
keep lying down.
Okay.
Actually, keep lying down is not good for health. It can cause venous
Deep vein
thromboembolism. Like the
thrombosis
blood
and then
can get
pulmonary
clotted
embolism.
in the
Yes.
legs, and it can get, as we always say, it can cause pulmonary embolism. So ambulation, little bit of movement. Even in case of cesarean section, you can move after 6 hours. Once the spinal anesthesia wears off, we ask them to move the limbs in the bed only. Then we make them walk to the bathroom to pass
Bathroom.
urine. So you can move. There is nothing like that. Cesarean means you have to lie down. No. And even exercise will help you. The bowel movements will be good. So whatever bloating they get will get down. And exercising will improve their mental health. And they will feel happy. And one more thing is it will increase the breast milk secretion. Usually we advocate upper limb exercises, neck exercises.
Yes.
So that will improve the uh, formation of breast milk, and it will also help them in low backache. Otherwise, usually they start complaining low backache.
Yes.
So exercises will help them to elevate this also. Then what is the most important thing is they think once delivery, it's okay. They never come back to us. They come back after next pregnancy when they become pregnant again. No.
Yes, that is true.
Yeah.
I've
That
seen
was
that,
the trend, but nowadays it's changing. They have to come back us at 6 weeks. Okay.
Okay.
That time we check whether they are going, their puberim is normal, whether they are returning to normalcy in a proper way. We check their height, weight, they check their BP, and if they had hypertension or diabetes during pregnancy, we do check their hemoglobin, we do check their blood sugars to see whether they have come back to normal.
Normal.
Yes. And then we give them advices on contraception because this is the time they know now their responsibility. The baby is small. They have to take care of the baby. So when we give information now, they are very receptive. They understand that they have to keep a gap between the two kids. So we give information on
And
contraception.
what about the mental health? I see many women, they are so much having anxiety and other problems. What about the mental health? And sometimes they'll have the Takotsubo syndrome and the heart pumping will go down after the delivery.
Yeah, mental health is also of most important. It depends on good sleep, sound sleep. So they should be allowed to have a good sleep, and they should be given help to manage the baby. Otherwise, they can have baby blues, what we call. They are not. They take time to get adjusted to their new state. They can go into depression or they can go into psychosis. They might harm themselves as well as the baby. So
Baby
mental
also.
status
Yes.
also is important.
It's very
Actually,
important.
yeah, whenever we give them a Thai card, that is a RCH card or the mother card, there are two sentences to ask them, two questions to see their mental status. And this card is given to the mother, and even the ASHA workers know that these two questions have to. So it is a screening to see their mental status. So not only the physical health, we also have to monitor their psychological health.
Yeah. Because, if they get mentally depressed or go into psychosis, they can harm the baby and also their milk production also will come down. So that's how we know their physical health, mental health, and also
Emotional health.
the emotional health. All are very important, and how everyone reacts and interacts with them. So thank you very much, Dr. Raj Lakshmi, for giving so much of information. And I'm sure all our viewers, they will learn a lot from your advice, and then let them all have a very wonderful motherhood. Thank you very much.
Thank you, ma'am. Thank you for the opportunity.